best response rate that we saw for the study group overall was 21%. The overall response rate for the patients treated at the maximum tolerated dose was very encouraging at 40%, including complete remissions, and that was important. Also, when we looked at the best schedule, the response rate actually was quite encouraging at 55%, which, remember, this is just 480 plus dexamethasone. All these patients were steroid refractory. So this is not this was an important signal. And what was particularly exciting in those patients in the 1 milligram, 3 weeks on, 1 week off group, the majority, 70% of them, were triple class refractory. And in that group of patients, we saw complete responses and very good partial responses, which I think is really exciting. And then the final piece of it was that we looked at patients with extramedullary disease, who are this very vulnerable group. And we were so pleased that at 1 milligram, we had responses. And not only did we have responses that were reflected by paraproteins, but we also had disappearance of extramedullary disease on scans. And that was really something that was not necessarily expected, especially from an oral agent. And the final comment would be that these responses all proved durable. So preliminary data and numbers remain relatively small, but for a large intent to treat population, these data, I think, are quite encouraging as we go forward.